time, we got to say good morning to all participants. Welcome all seminar participants and finalists of the Nursing Scientific Festival International Seminar 2025. Your presence here today is truly appreciated and we are thrilled to have you here.
But the ice on the road, driving home all alone, singing along to a song from 3 summers ago. The one that made
We
you
would like to welcome the invited guest, BPI Hingga Jaya, Kak Rizka,
as the
to join us here today.
your life ended with. If a
And please remember, all participants in the amphitheater are expected not to eat or drink while the amphitheater and to mention a conducive environment too.
it don't seem so bad. Either way, I still wish you were here. Don't say everything's meant to be, 'cause you know it's not what I believe. Can't help but think that it should have been me. Either way, I still wish you were here. And they say you're in a better place, but a better place is right here with me. Yeah, they say you're in a better place. Too bad it's not what I believe. 'Cause a picture is all that I have to remind me that you're never coming back.
Now, we remind all participants to fill out the arrival attendance and please send the committed chat Zoom can send the attendance link in the Zoom chat room.
We inform all participants and finalists who have joined to fill in the attendance link provided by the committee in the Zoom chat room.
Once again, we remind all participants to fill out the arrival attendance and to finalists who have joined to fill in the attendance link that provided by the committee in the Zoom chat room.
Once again, we welcome all seminar participants and finalists Nursing Scientific Festival 2025 who have joined through the amphitheater and Zoom meeting room.
And we kindly request all seminar participants and Nursing Scientific Festival competition finalists who have joined to change their username with the format. Seminar participant may use their full name and finalists may use competition branch underscore team name underscore full name.
Can't show you how to love yourself, but I promise you I'll be the one by your side.
All participants in the amphitheater are expected not to eat or drink while in the amphitheater and to maintain a conducive environment too.
It's so difficult for me.
Once again, all participants in the amphitheater are expected not to eat or drink while in the amphitheater and to mention a conducive environment too.
We inform all participants and finalists who have joined to fill in the attendance link provided by the committee in the Zoom chat room.
We inform all participants and finalists who have joined to fill in the attendance link provided by the committee in the Zoom chat room and group WhatsApp.
Okay, Mifta, while waiting for the other participants and finalists to join, how about we say hello and share with one of these participants and finalists here?
Okay, of course, JJ. Who would you like to say hello to?
Well, maybe we can start with you. Could you please join with us? It's okay. It's okay to use Indonesian.
Yes. You can speak Indonesian for answer us.
Okay, can you please introduce yourself?
Baik, perkenalkan nama saya Ilham Nur Ramadana, saya dari PSIK Angkatan 25.
Nice to meet you, Mada.
And how are you today?
I'm fine,
Okay. Are you excited to be here?
very excited.
Very excited.
Okay, big applause for you.
Mada. Exactly. It's wonderful to hear your enthusiasm and we share the excitement with you as well. Well, thank you, Mada.
Okay, last but not least, we would like to remind all participants and finalists to turn on their camera while keeping their microphones off during this seminar.
We inform all participants and finalists who have joined to fill in the attendance link provided by the committee in the Zoom chat room and also group WhatsApp.
Okay, now I know my beloved partner JJ. How are you today, Jay?
I'm so happy to be here, Mifta.
Oh, really? And what makes you happy today?
I think it's very likely because we have an incredible morning ahead of us filled with knowledge, inspiration, and the celebration of nursing excellence.
Absolutely. Right now, we are not just attendees, but we are all gathered here to explore the wonders of nursing science. And what makes this event truly special is the diverse perspective we bring. We have experts, researchers, educators, and students all under one platform, united by our passion for nursing and a shared commitment to advancing healthcare.
It's indeed heartwarming to see so many dedicated individuals in one place. Throughout the day, we will be diving into engaging discussion, listening to inspiring speakers, and recognizing outstanding contribution in the nursing field.
Right, and we also have interactive session planned where you, our fantastic audience, can participate, ask questions, and share your thoughts. Your active involvement will make this event even more enriching and memorable. And who knows, you will be one of our best participants and will be rewarded at the door prize agenda.
Of course, Mifta. So get ready for a day filled with enlightenment and lots of fun. Let's make this Nursing Scientific Festival 2025 a day to remember.
Once again, we inform all participants and finalists who have joined to fill in the attendance that provided by the committee in the Zoom chat room and WhatsApp group.
First, let's pray and give thanks to our God who has been giving us some mercies and blessing, so we can attend and gather in this good condition and in happy situation. Considering that the time has shown 5 a.m., the seminar will begin. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, and benevolent greetings to us all. The Honorable Vice Dean for Student Affairs, Alumni and Student Entrepreneurship of the Faculty of Health Sciences Brawijaya University, Dr. Nianovita Wirawan, Bachelor of Food Technology, Master of Science.
And next, Chairman of Himkai Jaya, Kak Arindita Suwando. And next, Executive Chief of Nursing Scientific Festival 2025, Giska Mesha Octavia. And the invited guests, BPI Himkai Jaya, BPA Himkai Jaya, DPPL Himkai Jaya, and Dr. Nia Novita Wirawan, Bachelor of Food Technology, Master of Science as Vice Dean for Student Affairs, Alumni, and Entrepreneurship.
As well as all participants of the seminar and competition finalists of the Nursing Scientific Festival who are happy here.
Praise be to God Almighty for His abundance of favor so that we can all gather at the Nursing Scientific Festival 2025 in good health. Good morning and welcome to our audience at Nursing Scientific Festival 2025 with the theme Providing Care for Adult Patients with Complex Health Condition and Multiple Comorbidities. Here, I'm Miftah and my partner,
Jessica,
as the Master of Ceremony, will get the Nursing Scientific Festival seminar today.
before starting the agenda, it's a good idea to begin with a prayer to ensure that the event runs smoothly. Praying according to each individual's belief, let's begin. Prayers are enough. Let us read out the schedule of today's agenda. The first agenda is opening. The second agenda is singing the Indonesia Raya song and Mars PPNE. And the next is welcoming speech. The next agenda is presentation of material 1 and material 2. Ice breaking. The next agenda is presentation material 3 and material 4. Break enterprise. The next agenda is awarding of competition winners and documentation, questionnaire, and the last is closing.
In addition, thank you for the media partner who have supported the Nursing Scientific Festival. This event is also supported by Warung Juragan, a restaurant serving a variety of home-cooked dishes with distinctive flavors and catering service for various events. Not only that, Warung Juragan also offers catering for various events, from meetings and social gatherings to weddings. So, if you are planning an event but don't want the hassle of food, just contact Warung Juragan. We guarantee delicious food, just the right portions, and very affordable prices.
For those of you who miss home cooking or need particular yet delicious catering, head to Warung Juragan. Delicious, affordable, and sure to leave you waiting more. Thank you, Warung Juragan, for your support today.
And next, I would like to read the rules of participants and finalists. So, participants' role for today's seminar NSF because OB 2025 participants and finalists are required to attend the entire series of the Nursing Scientific Festival 2025 seminar from start to finish. And participant and finalists must use the username according to the format: seminar participant, participant underscore full name. To finalists, use competition branch underscore team name underscore full name. To scientific paper, use SPP underscore team name underscore participant name. To scientific poster, use SP underscore team name underscore participant name. To educational video, use EV underscore team name underscore participant name. To case study, use JS underscore team name underscore participant name. And to national quiz contest or LCT, use LCT underscore team name underscore participant name. And last, to photography, use PG underscore participant name. And next, participants are expected to join the Zoom meeting room and amphitheater. All participants are expected to wear polite and neat clothes. All participants joining via Zoom meeting are expected to mention a conducive environment and are required to mute their microphone during the event, unless instructed by the master of ceremony or moderator to unmute.
All participants in the amphitheater are expected not to eat or drink while in the amphitheater and to maintain a conducive environment too. All participants will be given a certificate with this following condition. Participants have successfully registered through the Google Form registration link and have attended the series of events for the Nursing Scientific Festival seminar. Participants are required to fill out the Nursing Scientific Festival seminar attendance, which will only be shared in the Zoom meeting room. Participants are required to fill out the evaluation questionnaire link, which will only be shared in the Zoom meeting room. Participants who do not meet the requirement according to the rules that the committee has made will be considered absent, and the committee has the right to cancel the certificate. All participants are expected to be able to take part in the Nursing Scientific Festival seminar until it is finished and in an orderly manner. Participants who break the rules will be considered absent, and the committee has the right to cancel the e-certificate.
It is informed to the participants and finalists that at the Nursing Scientific Festival 2025 seminar, this time there will be special prize for participants and finalists with the best question during the question and answer session with the speakers.
It is hoped that all participants and finalists can participate in the seminar from the beginning to the end of the event later.
Okay, ladies and gentlemen, to infuse even more enthusiasm and into this seminar, we will kick things off with a special jargon. Participants and finalists, please pay close attention. I will lead the jargon and JJ will demonstrate the movements. Okay, when I say Nursing Scientific Festival 2025, all of you can say empower chronic care, embrace the complexity feature. Okay, to the committee, please send our tagline to the Zoom chat column. Okay, participants and finalists, do you understand? Okay, please give me a big thumbs up. And if you have understood, we just can start with the jargon. Participants and finalists are requested to activate your cameras and microphones. Now, let's start the jargon. Nursing Scientific Festival 2025.
Empower chronic care, embrace the complexity feature.
Teacher. Big applause to us.
Well, after this, let us move to the next agenda. The next agenda is to sing the Indonesia Raya song and the Mars PPNE so that the audience could sit upright and neatly.
Please the committee to present the video of songs Indonesia Raya and Mars PPNI.
Persatuan Perawat Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan.
Ada yang join?
Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk mengantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila.
Mic-nya ini dimatikan.
Perawat majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Well, thank you to everyone for following the agenda so well.
Moving on to the next agenda is welcome speech. The first speech is a speech from the Chief Executive of Nursing Scientific Festival 2025, Kiska Meshaltavia. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, and warm greetings of kindness to us all. Good morning, everyone. The Honorable Dr. Nia Novita Wirawan, Bachelor of Agricultural Industrial Technology, Master of Science, SVS Dean for Student Affairs, Alumni, and Entrepreneurship, Faculty of Health Science, Universitas Brawijaya. The Honorable Kak Rifka Anindita Suwondo, as President of Himkazaya, Faculty of Health Science, Universitas Brawijaya. Our respected speakers, both national and international, whose names I cannot mention individually, and our esteemed judge, distinguished guests joining us both in person and virtually via Zoom, and all enthusiast participants of the Nursing Scientific Festival 2025. First and foremost, let us offer our highest praise and gratitude to the Almighty God, for it is by His grace that we are able to gather here in God health to participate in the seminar of the Nursing Scientific Festival 2025, which has served as the highlight of this year's event. Today's seminar, Career Rhythm Providing in Adult Care, a great significance in the advance of nursing science and practice. This event aimed to strengthen our understanding, competence, and compassion in providing quality care of adult patients, integrating professionalism, evidence-based practice, and innovation in every aspect of nursing. Through the seminar, we hope to gain deeper perspective and inspiration to develop into competent, empathetic, and globally competitive nurses. On behalf of the organizing committee, I would like to extend my deepest appreciation to all speakers, participants, and everyone who has supported the success of this event. Special thanks to the entire organizing committee, to Himka Jaya Vikas UB, and to all sponsors and to all sponsor partner whose dedication and support have made this seminar possible. To all participants, may this seminar broaden your horizon and strengthen your commitment to delivering excellent adult care. Let us make this event not only a platform for learning, but also a momentum to foster collaboration, professionalism, and the spirit of continuous growth in nursing. That concludes my remarks. Thank you for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Rizka Michelle Octavia, for giving us such a great welcome.
And next is a speech from the chief of Himka Jaya to Ms. Rifka Nidita Swando. Times is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, distinguished lecturers, honorable guests, and my fellow students. Welcome to today's Nursing Scientific Festival seminar. It is truly a pleasure and an honor to stand here before you as we gather to share knowledge, exchange ideas, and strengthen our understanding in the field of health sciences. This seminar is not only an academic event, but also a valuable opportunity for us as future health professionals to broaden our perspectives, enhance our critical thinking, and prepare ourselves to face real challenges in the healthcare world. On behalf of the organizing committee, I would like to express our deepest gratitude to our respected speakers for their time and willingness to share their expertise with us. We also extend our appreciation to all participants who have joined this event with enthusiasm and curiosity. We hope that today's seminar will inspire us all to keep learning, innovating, and collaborating because the future of healthcare lies in our hands. Thank you very much, and I wish everyone an insightful and meaningful seminar. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ms. Rifka, for giving us such a great welcome.
Next is a speech from the Vice Dean for Student Affairs of Faculty of Health Science of Universitas Brawijaya. And please as well inaugurate the Nursing Scientific Festival seminar this morning to Mrs. Nia. Times is yours.
Om Swastiastu, Namo Buddhaya, Salam Kebajikan, distinguished guests, esteemed speakers, and fellow participants from around Indonesia and neighboring countries. It is a great pleasure and an honor to welcome you to 2025 Nursing Scientific Festival held by the Nursing Student Organization, Faculty of Health Science, Universitas Brawijaya, with the theme Providing Care for Adults with Complex Health and Multiple Comorbidities. The Nursing Scientific Festival is designed to share ideas and experiences among nursing and other health students through competition and seminar. It will increase the awareness towards health problem of the population and creating the innovative solution. Moreover, it also fosters collaborating ideas to navigate these challenges together. We are particularly honored the presence of invited speakers, Dr. Kaiko Oda from New Zealand, Associate Professor Dr. Nick Noor from Malaysia, and all other distinguished speakers from Indonesia. From today's seminar, you can look forward to insightful keynote speeches, engaging panel discussion, and hopefully open the opportunities for networking. Please be actively participate, share your perspective, and connect with your peers. Let us make this seminar a truly productive and inspiring experience for all. Thank you for being participate. I wish you all a successful and engaging seminar. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Ms. Nia, for giving such a great welcome.
All right, before we are moving on to the next agenda please let's do a documentation first.
To all participants, please turn on your cameras because we will do the documentation.
Okay. Because all participants are ready, please the committee might do the documentation.
Okay, thank you to everyone. Well, ladies and gentlemen, then enter this event, which is the delivery of material, and of course, will be guided by a very amazing moderator. Let me read the CV of our first moderators. Please, the committee present the CV. Okay, our first moderator today has a lot of community service experience, one of which is community service of metabolic syndrome screening, organized by UB for the GPPS Mojorayu Medium Congregation, volunteering at the Brawijaya University Disability Service Center, community service for healthy and cool students, Pondok Sehat Santri Keren, organized by UB for the Ar-Rahma Putra Tafiz Islamic Boarding School.
And our moderators also have a long track record of accomplishments such as bronze medal in social science, humanities, and arts at the Indonesian Student Research Olympiad, third place in the Outstanding Student Ficus UB Award, and second place and best presentation in the Outstanding Student Ficus UB Award.
Our moderators also have organizational and committee experience, such as UBFICUS 2024 Public Relations Events Division Staff, BPI 2024 New Student Community Service Workshop, BPI 2024 Open Issue Study, and our moderator has studied at Universitas Brawijaya. Okay, without any further ado, let's welcome Ms. Ilmi Rotlatun Nafia.
Okay, hello, Ms. Ilmi. How are you today?
Okay, thank you so much for the time. I'm so happy today because I can see a lot of people here. I see the motivation to join this agenda. So for sure, I'm very happy and exciting for being moderator in this agenda.
I'll be glad to hear that. It looks like Miss Ilmi ready to guide the course of giving material, right, Miss Ilmi?
Yes, I'm ready for sure.
And before that, we remind our participants and finalists to remain conducive during the material agenda by turning on the camera and deactivating the microphone. Next, we hand over the program to Ms. Ilmi.
Okay, first of all, thank you so much for the Master of Ceremony. Well, good morning, everyone. Okay. Are you already tired in this morning? Because actually, I can't hear your voice. So let me repeat once again, and please answer it as loud as you can, okay? Uh, Good morning, everyone. Well, I hope you can in the good health wherever you are. So let me introduce myself again. My name is Ilmira Datunafia as moderator to today's event seminar of Nursing Scientific Festival 2025. But before that, allow me to sit down first, guys. Okay, thank you so much. So on this morning occasion, we will witness together the presentation of material from 4 speakers with 2 speakers, namely Miss Keiko and Miss Nicknor. Okay, for the first, to the committee, on duty, please share screen to display the CV of our first speaker for today. All right, for the first speaker this morning, please allow me to briefly read her professional background. Our first speaker this morning has made remarkable contribution in the field of nursing, especially in the area of oral health and elderly care. She has presented her research in many international conferences around the world, including Japan, New Zealand, Australia, and Indonesia, and was invited as a keynote speaker at the first international conference on Health and Biology Science, IHSBS, in 2024. Her works have been published in several reputable journals, such as first, Improving Nursing Oral Care Practice for Community Dwelling Care Dependent Older People in the International Journal of Older People Nursing in 2024, and then Workplace Oral Health Promotion Activities Among Community Aged Care Workers in 2024. And also nursing oral health assessment training, putting the mold into the head-to-toe assessment in 2022. For her dedication to nursing research and education, she received a McCutcheon Fund in the Nursing Education and Research Foundation Award in 2024 and the Mangara Mai NSNO Scholarship in 2023. Currently, she serves as a clinical lecturer at the University of Auckland and a clinical educator at Elizabeth Knox Home and also hospital in New Zealand. In terms of academic background, she obtained her doctoral degree in nursing from the University of Auckland in 2024, her master degrees in health sciences with first class honor, and her bachelor of health science in nursing from the Auckland University of Technology. Her professional journey began as a registered nurse and later developed into a researcher, educator, and international speaker focusing on integrating oral care into nursing practice and interprofessional collaboration for the well-being of adult people. And now, please welcome Miss Keiko Oda, clinical lecturer from the University of Auckland, New Zealand.
Selamat pagi, everybody. Nama saya Keiko. My name is Keiko. I obtained a PhD from University of Auckland. Today, I'm really happy to share my research throughout my master degree as well as PhD and postdoc research activity. Currently, I'm doing oral care practice into a aged care facility in New Zealand. So hopefully what I share with you is something relevant with your nursing practice in hospital setting as well as community. So I really like to share my slide. Sorry, can I share my slide by myself or you gonna navigate my slide? Is that okay to share screen? My slide, can you see my slide? Can everybody see my slide? Sorry, I need to check.
I'm sorry, Miss Keiko, for bothering you, but in Ontario, we can't hear your voice clearly.
Oh. Hello, can you hear me?
Yeah, we already can hear you right now. Thank you so much.
Okay. What about my slide? Can you see my slide? Hello? Hello, can you hear me?
Yeah, Keiko,
Yes.
this is Sila.
Hi, Sira.
Yeah, we can see your slides in the Zoom meeting, but we still have a trouble in the.
Oh, you can't.
So please wait.
Okay,
Yeah.
I wait. Uh-oh. I think my side microphone is on and maximum. Just we need to wait, I guess.
Okay, maybe for Miss Keiko, first of all, let me read the rules of presentation session. The presentation will last for 45 minutes, followed by 10 minutes for Q&A session, and the last is 3 minutes for of documentation. First of all, we want to say thank you so much for willing being speakers for this agenda. I hope you always healthy wherever you are, and you have a really great times in this morning. And we were sorry for the trouble. Please wait a second for the PowerPoint so can share in this room. Okay, Ms. Keiko, because the PowerPoint is already here in the screen. For Ms. Keiko, time and screen is yours.
Okay. Thank you for your patience. Selamat pagi. Nama saya Keiko. My name is Keiko. I'm a nurse. Currently, I'm working in hospice to look after the patient who is about to complete their life. And I really believe nursing oral health assessment and then care delivery is very important to integrating into our daily practice to save life as well as to promote patient comfort and protect their dignity, including family member. Okay, so I just want to move on to next slide. Sorry. I was doing PhD research back in 2023. I was in Ireland sharing my PhD research with Galway University students. On that day, I got referral from one of the patients who is in Tokyo Metropolitan Hospital. He's 97-year-old. Family member asked me to help his condition. He contacted was COVID-19 at age of 97. Before he got COVID, he was independent, only got hypertension and some just really minor cardiovascular problem. After he got COVID and hospitalized in February, his condition is deteriorate very fast, and nursing staff is just monitoring his infection marker and try not to give him anything from oral. So he kept nearby mouth, and he got IV intravenous antibiotics and fluid, but nobody really do good oral health care. So as you see, his mouth is really dry, and you can see plaque become more calcified. And he really wanted to taste lollies, but nursing staff and doctor said, nearby mouth, nothing through mouth. Please keep him nearby mouth. And then family member asked me whether we can alleviate his dry mouth. So I contacted with my colleague, dental hygienist, professor from medical school, and we really collaborated with dental hygienist family, and I suggested how to position himself, neck elevation, and turning left and right, and for oral cavity moisturizing with gauze and wipe, and in 3 days oral care with carers, his condition improved, and he's able to swallowing his own saliva, and he tasted lolly, and he's regained his strength to sit up in a chair, and he started to do his own regular things like watching TV and reading newspaper, who was bedbound for 1 month, but after oral care, listened to his needs, dry mouth care, and he regained his will to be himself, and he can, regain more sense of dignity, and his own, ADL function is improved. So family member said to me, oral care is mouth care, which is tangible and really alleviating his agony from dry mouth. He gained voice, eased his breathing. He also trusted, regained hope. So this is something really tangible example of oral care is one of the most powerful nursing intervention. Back in 1960s, the seminal nursing professor and philosopher Virginia Henderson also stated, quality of nursing care can be judged by the state of patient mouth. With my really, experience and also my own practice and her own, discipline, it's really much with what need for older people who are going through chronic condition and get close to end of life. So one thing the patient who mentioned is he got aspiration pneumonia. Pneumonia is most common cause of mortality in older people. And if you look at it, 90%, this graph, 90% of pneumonia is actually aspiration pneumonia for older than 80-year-old. So you can see pneumonia, occurrence of pneumonia, and aspiration pneumonia is orange. So older people, pneumonia is mostly aspiration pneumonia. So I like to talk about aspiration pneumonia and difference from pneumonia from now on. So character of aspiration pneumonia is not so typical in terms of symptom. So symptom is like the older people is not eating well or not standing well or not actively participating into the daily function. Or sometimes people become lower level of consciousness. Some people get delirium, and sudden onset of incontinence is really symptom of aspiration pneumonia. And if you look at it, X-ray, chest X-ray, aspiration pneumonia could be bilateral, and comparing to bronchiolitis, right side, aspiration pneumonia is more posterior and right side focus, which means patient develop aspiration pneumonia is not mobilizing well, tend to get bed bound. So basically gravity and aspiration get into their lower lung posterior side and takes 1 week to 3 weeks to get symptom. So slowly develop symptom so that patient themselves or family don't notice inflammation, hypoxia is progressing slowly. That is a really key of aspiration pneumonia. Not so clear. Progression is slowly. That's why people don't notice. But age 80-year-old pneumonia, mostly aspiration pneumonia. That's what I want you to remember. So in Japan, because of 30% of population is older than 65-year-old, people are really looking at aspiration pneumonia is one of the cause of death for people who are not able to mobilize themselves or people got dementia. So this is one example of the photo aged care facility in Japan. This aged care facility always collaborating with dental hygienist, left side person, and healthcare assistant doing oral care for bed-bound patient every day. And the dental hygienist always advise them what is the best way to do oral care for individual needs. So this facility really achieved good care, and nobody, even patients who are totally bed-bound, had no one developed aspiration pneumonia. It's a good example of, evidence-based practice. Oral care can prevent aspiration pneumonia. And another example is acute stroke ward in Japan. They standardize oral care for patients who got first symptom of stroke. So after standardization, occurrence of aspiration pneumonia, febrile, tracheotomy, pig feeding, improving ADL, discharge to home is all different, right? Standardization, good oral care can improve patient outcome in stroke ward as well. So internationally, I'm looking at oral care can prevent patient poor outcome. So you can see a lot of example in here. However, in hospital internationally, 44 to 65% of older people don't receive oral care. That is dropout study in 2015. That same as my master degree study in 2 public hospital in Auckland. So therefore, I thought it's gonna be a real good opportunity for us, for the nurse to improve oral care so that patients improve their outcomes. So this is my framework to think of oral care to stop deconditioning of older adults. So getting older, people tend to lose muscle. To swallow food require 40 different muscles inside the mouth as well as neck and shoulder. So if you are malnutrition, not mobilizing, dysphagia, swallowing problem progress. If you have swallowing problem prolonged time, you get malnutrition problem. So you lose muscle mass, muscle tone, sarcopenia. If you get sarcopenia, you are likely to get aspiration pneumonia because of not mobilizing well. You are not be able to sit up to support your neck. So if you cannot sit up, support your neck, you cannot swallow well. So aspiration pneumonia progress. So once you get aspiration pneumonia, your sarcopenia worsening, your swallowing function worsening. So this is bidirectional vicious circle. So oral care has 2 functions. One is oral function rehabilitation. Secondly, oral cavity hygiene. So bacteria accumulation will be stopped by good oral care, dehydration, and mouth muscle rehabilitation. So oral care has a lot to stop this bidirectional vicious circle. This is my framework to think of oral care. It's very important for chronic care-dependent older adults. So oral cavity and eating is basically activation of 12 set of cranial nerve. So you can see, looking at smell of food is basically eye stimulation. Olfactory smelling is really important. And you can see the food and moving eyes and decide what to eat. So it's a lot of neural, activation happen for eating. So that oral cavity, looking after mouth care means maybe supporting people's, stimulation of looking at the food and smelling food, so that stroke patient doing oral care would be really good support for them to regain neural pathway, cranial nerve activation, rehabilitation as well. So let's look at this table. This is WHO's data. So what I like to say is number one disease for any country is oral disease. If you live in Africa or Indonesia or Japan or America or New Zealand, number one most common disease is oral disease. And the oral disease is not just remain in your mouth, it's connection with whole body system. Especially if you got type 2 diabetic, you are likely to get poor oral health because of not good secretion of saliva and inflammation. But just doing oral care can control blood sugar level as well. So that's what many researchers said. And if you got good oral health care, you are less likely to get stroke or cardiovascular event. We have more and more research evidence the effectiveness of oral care into systemic health. So it's really important to get dental care periodically. But in New Zealand, we do not have a good oral health record for all population because mouth care, dental cost is so expensive in New Zealand. So people are not really attending regularly because of the cost. So 50% of adults don't attend dentist periodically because of cost. So that affecting people's health, systemic health, and work productivity. People calling sick because of pain. So for older adults, to get denture is so expensive. So that cost of dentistry is really affecting people's affordability attending oral care. So many people having a bad teeth and many people losing teeth in age of 65. So 30% of older